Welcome to the conference and thank you
Thank you.
so much for being with us.
Thank you.
Uh, one of the things that I find with parents in India is that they are extremely confused. They don't know where the assessment starts and where it ends.
Right.
They don't know when the intervention starts. And
Right.
so, what is your recommendation about bringing awareness in the parents? Because we as treatment providers are working on awareness,
Right.
but the medical community isn't to that extent. So, how do you think we can?
I think I'm not surprised that our parents are confused because there is so much confusing information that is being given to them from a lot of different places. I think they get mixed messages from they get mixed messages from their friends, their family. They get mixed messages from, and I hate to say this because I am one of the medical community, but I think they get mixed messages from medical community. It is, which is why when I said over there that you have this one chance when you get this patient and this parent, this family, you have this one chance to make an impression on this family. The reason I say that is the minute they walk out of your office, they're going to be bombarded with all kinds of mixed messages. They're going to be bombarded with messages from family, from the internet, from therapists who are not fully qualified, and from doctors that sometimes are not well informed. Right, so they get bogged down with too many mixed messages. So I think us as medical community, as pediatric community, we need to get our message straight. We need to get a unified message out there, and it doesn't have to be very lengthy. All we need to put out over there is a pediatrician is in the best position to identify kids at risk, and you can feel free to start doing it around 18 months. A pediatrician does not have to feel guilty about talking about autism with the family. I think a lot of pediatricians feel guilty. What if I'm wrong? Am I labeling this child? There is no need to label a child. Just identify a child at risk. And in a community, there is always at least one provider who is experienced in assessing and making a diagnosis, right? See, in India right now, we don't have one specialty that takes ownership of making a diagnosis
Right.
and assessing the child. We have psychologists that do it, we have psychiatrists that do it, we have neurologists that do it, we have developmental pediatricians that do it. So a lot of different people are doing it. This is my thought. We need everybody that we can get. We just need to get trained well. Right?
So, is everybody using the same tools?
No, no. See, and again, that's what I'm saying. We just need to get our message straight. We just need to get our training right. So, you in your community, if there is a neurologist who is experienced with, or has a team, has a psychologist who is administering these tools and who is doing a proper assessment, it's okay to go to them. In other communities, it's the developmental pediatricians that are doing it.
Okay.
Right? And it's okay to go to them.
Right.
It's okay to go to them. I think as medical community, we just need to get our act together, and we need to and the guidelines are out there. IAP
Right.
put it out there,
Yes.
right? We just need to follow the guidelines.
Okay.
IAP put it out like last year, and they're very similar to the CDC recommendations, AAP recommendations. They're pretty much exactly the same, right? So we just need to follow those guidelines. And given how many kids are getting diagnosed, we need everybody that wants to do it. Not a lot of people want to do it.
Right.
If a clinician is interested in it and is willing to get trained and is willing to do it properly, it would be okay for the parent to go to them, right? So, but right now, people that are not trained, people that really don't know a whole lot of, they don't have a lot of experience in treating autism spectrum disorders, and they make the diagnosis. I see some therapists administering cars, which goes back to my original point. It's not about the screening tool. It's about selection of the proper screening tool for the patient, and it is about the person that is administering it, whether or not they have clinical experience in children with autism. I have seen kids who, according to some clinicians, will score 15, 16 on cars, which is like not autism.
Right.
They come to me, they clearly have autism.
So even the diagnostic
So,
tool
so if you have, see, these are psychological tools, right? So if you don't know how to administer it, if you don't know how to interpret it, then there's no point. Now, you take a child that's extremely shy and somebody who just mechanically knows how to administer even ADOS, let's say. They administer it, the child is going to score high. And if they take that score and if they make a diagnosis of autism without interpreting it in light of all the information from the family, without the benefit of their own experience in seeing children with autism, then the entire testing is wasted. So I think it is, how can we get our clinicians trained in understanding autism in depth, the diagnosis of autism, and learn a couple of tools well.
So in your medical conferences, do you have workshops like that? Or do you think a conference like this would be a good idea?
I think a conference like this is needed. I don't think that, now again, it's hard for me to properly comment on that because I am not involved in medical teaching in my career right now, and I don't know what the curriculum is for pediatric residents and stuff right now. I don't think people are getting the training that they need. I think psychologists should be trained in how to administer CARS because that is the most commonly administered tool. And people don't know how to administer it. They ask the parents the questions, and that's not how you're supposed to do it.
Which is what I've heard.
They ask the parents the questions. So so then the purpose of the tool is lost. The purpose of I think what we can do is we can take groups of people and we can teach them how to administer these tools, and we can teach them about autism spectrum and what autism is and what it isn't. Right? I think this is easily done.
Right.
I think it can be done. Is it already in medical curriculum? I don't think so.
So what is one message that you would like to give to the parent who has a child who's been recently diagnosed? What is your guidance that you would like to give to them?
Well, if you are a parent
because right now I was talking to this parent who's come from Jamnagar,
right,
Gujarat, and after this whole day she's asked me questions about gluten-free,
right,
about atta diet, about MChat.
Right.
So it was like,
Right.
what were we doing?
So I mean, if there is only a couple of take-home messages I want to give to the parent, the first thing I want to tell you is MChat is available on the internet free, and it will be scored for you. Now, if you are somebody who can honestly answer those questions, now I have parents that don't honestly answer those questions because they're scared. If you can honestly answer those questions, go online and do the MChat. It is very easy, very simple, and the website will score it for you. It's available in 2 or 3 different websites. I think autismspeaks.org has it. It is a very good indicator of risk if your child is between 16 and 30 months of age. One, I want all the parents to know about it, right? And 2, if your child is already diagnosed with autism, I understand the hopelessness that you feel. When you go to a doctor and the doctor says there is no medication, you take him to therapies and the doctor will not say that your child can be cured. I understand. I experience it all day, every day with my families. I get it. I really do. But what I need you to also understand is that there is nothing that is better than therapies. There's nothing at this point that we know with proper scientific evidence that works for autism better than therapy. Now, I'm the first one to admit that you don't start therapy and things don't change overnight. I get it. But there is nothing else that will do it. And our best hope is therapy. So I need you to start those therapies for your child as soon as your child is diagnosed, because time, it's all about time. If you lose those crucial 2, 3, 4, 5 years, then you will have done a disservice to your child.
So one final question about the conference. How do you think it was? What did it bring on the table for everybody?
I think we had so many eminent speakers, and I learned a little something today from the behavioral therapist. I'm not a therapist, right?
Yes.
So it's not my job to do therapy. I tell parents I don't know how to do it. So I learned a little something today. I think all the parents, my hope is that learned a whole lot today. I hope that they can take a few of these messages home to help their child. Because it can be, if your child is newly diagnosed with autism, it can be a very, very confusing world out there. It can be a frightening world out there. So I hope that there was some clarity today, because I saw a lot of our speakers give message about early diagnosis and intervention, which is, I think, a very important take-home message, and that there is no medication that will treat the core symptoms of autism, and that there is no alternative therapy that has evidence to support its use in autism right now. So I think if a parent that has attended this conference got those 3 messages, then I'm happy, and I think a lot of them have.
Okay, so thank you so much for being
Thank you
here.
for inviting me,
And it has been a pleasure meeting you again.
and you
and
too.
maybe we need to work together and do
Maybe.
some research
Yes,
with the children that you recommend to us, going back to you, and then we
Sure.
can collect some data on that.
absolutely,
All right.
absolutely. Alrighty.
Okay.